Cardiac risk factors 2. This presentation should be used for general information purposes only. It is not a substitute for specific medical advice from a GP, specialist, or other healthcare professionals and should not be used as such. For individual cardiac rehabilitation advice, please consult your local cardiac rehab team. If you are experiencing any changes in symptoms, please seek advice from either a GP or specialist. In the event of severe chest pain or breathing difficulties, please dial 999. The aim of this presentation is to have a brief look at some of the risk factors that can cause coronary artery disease. We will also look at ways of managing these risk factors. Firstly, smoking is one of the biggest causes of heart disease, and you can see from this slide all the ways it can be harmful. Smoking is generally both a habit and an addiction, which makes it extremely difficult for some people to quit, but it is very important to do so for the long-term protection of your heart. Unfortunately, even one cigarette a day is enough to cause you harm. There are lots of products available to help you quit, such as nicotine patches, gum, and inhalators. Some people use vapes, but not enough research has been done to know the effects of using one of these long term. There are also some medications available that people can take to help them quit. If you feel you need support to quit, you can access this via your GP practice, pharmacist, or via the Stop Smoking service. Their telephone number is on this slide. Remember, it is never too late to stop, and the benefits of doing so are huge. When you quit smoking, the benefits to your health are almost instant and continue to improve long term. It's great to think that if you successfully stop smoking, after 2 years your risk of having a heart attack is virtually the same as a person who has never smoked. And don't forget all the money you will be saving, which you could use to treat yourself to something nice. Alcohol. Drinking over 14 units of alcohol per week can in time lead to serious health conditions such as heart disease, liver disease, strokes, brain damage, and some cancers. Not drinking alcohol is the healthiest option, but cutting down rather than stopping completely is still an important lifestyle change. It is also important to avoid binge drinking, which is when you save all your alcohol intake for 1 or 2 nights. A binge session usually means drinking more than 6 units in one go. The size and strength of a drink will determine how many units it has, but as a guide, there is approximately 1 unit in a shot, 3 units in a 250ml glass of wine, and 3 units in a pint of beer, lager, or cider. There are also a lot of hidden calories in alcohol, so drinking excessively can cause weight gain. If you would like further information, please visit www.drinkaware.co.uk. Weight. People are at increased risk of heart and circulatory diseases if they are overweight. This is because carrying weight makes your heart work harder and therefore raises your blood pressure. Being overweight means you're more likely to have high cholesterol, which furs up your arteries, increasing your risk of a heart attack and stroke. Being overweight also increases your chance of developing type 2 diabetes, particularly if you carry more weight around your middle. It is important to try to maintain a healthy diet that is low in salt, sugar, and saturated fat, and to keep as active as possible. Losing even a small amount of weight will benefit your health, but it is important to do it slowly and steadily, aiming for 1 to 2 pounds per week, as this is more achievable and means the weight is likely to stay off longer term. Think about your portion sizes and maybe swap your dinner plate for a side plate. Also, think about the way you cook your food, as grilling, steaming and baking is much healthier than frying. Type 2 diabetes. There are 2 types of diabetes. Firstly, there is type 1 diabetes, And this is when a person doesn't produce any insulin, and it usually develops in children and young adults. Type 2 diabetes is when the body doesn't produce enough insulin or is unable to properly use the insulin that's being produced. Most people with diabetes have type 2 diabetes, and this tends to develop later in life. People who are more at risk of type 2 diabetes are those who are overweight, especially around their middle, those who are physically inactive, and those who have a family history of diabetes. Type 2 diabetes is a risk factor for the heart, as it can damage the inside walls of the arteries, making them more likely to clog up with cholesterol deposits. It can also increase the risk of high blood pressure and can weaken the heart muscle, making it less likely to pump efficiently. The good news is that type 2 diabetes can be managed very successfully with the right lifestyle changes and medications, and in some situations, it can even be reversed. Losing weight is key for good glucose control, as well as eating a healthy, balanced diet. Keeping physically active will also help to achieve good glucose control, which in turn will reduce the risk of complications developing long term. It is important to attend for diabetic reviews at your GP practice or with your diabetic specialist at least once a year. If you would like more information on diabetes, please take a look at the diabetes.org website. Other risk factors. There are other risk factors such as lack of exercise, unhealthy eating, cholesterol, blood pressure, and stress. Please see our separate videos for more information on these. You can also find information on risk factors via the links on this page. The end. Hope you have enjoyed and thank you for